Good morning and welcome everybody to our webinar this morning on preparing for a new normal in social care. My name's Kathryn Smith. I'm the Chief Executive of the Social Care Institute for Excellence, and I'm delighted to be chairing this event this morning for us. Very pleased this morning to have our event sponsored. Oh, sorry, the screen just changed before me. We're very pleased this morning to have the event sponsored for us by BMB International Recruitment. There should be some information on the slide about them there, so you can see that they work to find exceptional international placement services worldwide and are a global leader in healthcare recruitment. So thank you very much to BMB International Recruitment for your sponsorship of this event. Next slide, please. So the agenda today, very shortly, we're going to move on to our speakers. As you can see, we have a fantastic lineup of speakers. I'll introduce each one of those as we get to them, starting with the Right Honourable Damian Greene, Professor Martin Greene, Barbara Keeley MP, then we'll move to questions and answers. Then we have Gary Bowlett, then Mike Padgeam, and then Simon Bottery, and then we'll have some more questions. I will introduce each speaker as we come to them. Next slide, please. So, as I say, there will be 2 questions and answer sessions within the webinar this morning. So if you do have any questions for the panellists, please put them in the Q&A, which is at the bottom of your Zoom screen, and I will pick those up and address them to the panellists at the end of each of the sessions. So there'll be questions for the first 3 panellists and then questions for the second 3 panellists. If your question is for a specific person, then please say so. Otherwise, I will address it to the person I think is best able to answer that question. Next slide, please. And if I could just remind you all to get nominating. We've had a fantastic year in social care in that we have expected so much of our people. Our people have worked so hard in such difficult circumstances, and it really is important that we recognise them all for everything they do. So do get nominating now. We've got the Great British Care Awards, the Social Care Leadership Awards, and the National Learning Disabilities and Autism Awards. So please get nominating. And then next slide, please. And a special mention, of course, to the social care COVID heroes. Thank you, everybody, for everything that you've done during this very, very difficult time. And then lastly, if I could just, next slide, please. If I could just mention, we have a face-to-face conference coming up. This is very exciting. The 30th of June at the Mermaid in London. All of the speakers that are showing there on the slide, hopefully you can see that they're all confirmed, and hopefully we'll be able to go ahead as the restrictions will have eased by then. I'm very much looking forward to getting together, meeting people face to face, doing a bit of networking and hearing from people again. So hopefully you are too. Get your tickets booked for that event, as it will be upon us before we know it. And so without further ado, I will move on to introducing the first of our speakers. So Damian Greene was first elected to Parliament in 1997 to represent the Ashford constituency, and most recently he was re-elected in December 2019. He is a former financial journalist, educated at Reading School and Balliol College, Oxford, becoming president of the Oxford Union in 1977. Thank you very much, Damian. Over to you. I think you're still on mute, Damian, sorry.
You'd have thought after a year of Zoom, I would have got past that stage. Schoolboy error.
No problem,
Apologies,
thank you.
and good morning. I'm billed to talk about the barriers to a new normal emerging in social care, but inevitably I think I'll add some of my own thoughts about possible solutions. Everyone on this call will know how long this has been an issue, and I think it's longer than many people think. Doing a bit of research, the first political commitment I could find to say this is now a problem that we need to solve urgently was Tony Blair talking to the Labour conference in 1997. So it's the best part of a quarter of a century that in Britain it's been seen as an issue that needs to be addressed urgently, compounded by the fact that some other countries did start addressing it in the 1990s. And there have been various attempts since then, all of which has fallen either at political or economic hurdles. The Labour government, as it came to the end of its period in 2009, produced a green paper and a white paper suggesting various models called Shaping the Future of Care Together. They thought either a partnership model where people would be supported by the government for around a quarter to a third of the cost of their care, or an insurance model where people would be encouraged to cover most of the costs from insurance, or a comprehensive model. That was promptly destroyed during the election campaign by my party, calling it a death tax. And so that wasn't very popular. The incoming coalition government then produced the Dilnot report, which is as close as we've got to a solution, in that we then passed the Care Act in 2014. And that essentially said there should be quite a generous threshold of £100,000, so that you could, that was a floor. You could keep that amount of assets before you contributed, and also there should be a cap so that Dilnot suggested £35,000 as the most you should have to pay for your own care towards the end of your life. As I say, that was passed into law, but never implemented, because in the middle of the period post the financial crisis, the government calculated that it simply couldn't afford it. Since then, the Labour Party has at successive elections suggested a national care service, which would be a universal public service. And most notoriously politically, in 2017, the Conservative Party under Theresa May promised essentially a variation on Dilnot, which would have a limit, again, on the means test, but would include the value of people's homes in that means test for those in receipt of domiciliary care. And the net result of that was that what had been a 20% lead in the opinion polls during the election campaign shrank to a 2% lead in the opinion polls. So the short answer as to why hasn't Britain grasped this nettle is that when it was grasped, it stung to the extent that it destroyed the authority of a prime minister during an election campaign. So that's why it's been so difficult. And why is it so difficult? I think there are two reasons underlying it. One is that people live under the illusion that social care is free until they start having to think about it. And most people, for most of their lives, don't have to think about social care. So this comes as a terrible shock to them. And I think we've had the most horrendous year in the social care sector because of COVID. The one small gleam of light in what has been a horrific year is that more people now think about social care more of the time, and therefore know more about it. And so therefore this widespread illusion that it's free in the way that healthcare is free in the UK, I think is now sort of less prevalent than it used to be. But the other great barrier to solving it still remains, which is that however you cut it, it's going to cost money. And telling people that they are going to have to pay for it is difficult, especially when they already think it's going to be free. So we are now in the position where, having promised to solve it during this Parliament, the government has to do so. My expectation is that they will publish a plan during the comprehensive spending review, which will be due out in the autumn. Certainly that's what they're working to. And indeed, it would have come out last year, except the comprehensive spending review was postponed because of the pandemic. So we are expecting it this year. So, the essential barriers are, one, when I say funding, it's not just the amount of money it costs, but also the mechanism by which that money is both obtained and spent. There are, I mean, it seems to me that trying to fund it out of local taxation, as we have done traditionally, doesn't work. It's going to be, we know that the demographics involve huge changes that in 2015, there were 3.5 million over 65s needing care of some sort. And by 2040, this will be 5.9 billion. Million, not billion. So that will just make the current strains on finances even worse over time. And so it does need to be addressed and would just overwhelm local government spending. So I think it has to be a national mechanism, whatever size you decide. But also, even more difficulty, how do you extract it from people? Do you just do it through taxation or national insurance so that it's all done on a collective basis? Do you have a mixture of that and some kind of individual payment? I think getting people to take out personal insurance policies would be very good. But if you do that, obviously you have to give them something in return for the payments they're making. Otherwise, why would anyone make those payments? So, I accept even my preferred solution has difficulties. I also think the debate needs to cover both all forms of residential care, but also crucially domiciliary care as well. It involves far more people than residential care, so therefore it's a more widespread issue in the population. And this is particularly an area where I think technology can help. We can enable people to live in their own homes, which of course they prefer, as well as being cheaper, for much longer. And we are only scratching the surface of what we can achieve with various forms of technology, both in terms of medical provision and also day-to-day living provision on that. And that, I think, is an area that we haven't gone far enough on so far. And the other point with regard to that I think we desperately need to address is the issue of, if you like, prevention of residential care, of enabling people in the most basic way, i.e. by design of houses, to live in their own homes for longer. I think, as I say, most people prefer obviously to live in their own home for longer, and therefore we need to be building and or converting more houses so it is possible to live in them, even if you are frail, and possibly even if you are in the early stages of dementia. This is an issue that essentially goes well beyond the health and care system and involves changes to the planning system and so on. But I think that's, if we do that, that would be a very, very productive form of change that we could have. We clearly need to address issues about the workforce. We already know there's a shortage of workers. It's probably too early to tell whether Brexit is going to have a long-term effect on the influx of workers into this country from other parts of Europe to work in our care system. But either way, it seems to me we need a much better career structure for care workers to make it more attractive, and also possibly pushing up wages at the bottom end as well. And in the end, a lot of these come to the tough decision about how much individual responsibility and how much collective responsibility are required to solve the care crisis. As I say, I think you need a bit of both. And the one other thing everyone says is that we need a cross-party consensus on that. That would be great, but candidly, the way we do politics in this country, I wouldn't hold your breath. I feel I'm clean on this. I co-chair with a Labour MP, Helen Hayes, the all-party group on adult social care. So I do my best, but I think, being realistic, it's going to be difficult to achieve a cross-party consensus on this. So we will, I hope, get the government's proposals this year, and I hope they're sensible. It's always occurred to me, I was responsible for this policy when I was first Secretary of State, and it has seemed to me that unless it's driven from the top and centre of government, you won't actually get a solution that pulls in all the various bits of Whitehall and local government that you need to pull together. So it is a hellishly difficult political problem, but I very much hope and expect that this year we will see a significant step towards addressing it seriously. Thank you very much.
Thank you so much, Damian. That was really insightful, and I certainly agree that we need to do more to be able to support people to stay in their own homes for longer when that's what they wish to do. I'm now going to hand over to our next speaker, but before I do, I just remind you all that if you have any questions for any of our panelists, then please put them in the Q&A box and I'll come back to them after the first three panelists. So our next speaker is Professor Martin Greene. Martin is Chief Exec of Care England. He's also the Independent Sector Dementia Champion and Chair of the International Longevity Centre in the UK. Martin has had an extensive career in NGO development, both in the UK and internationally, and as Chief Executive of Care England is the largest representative body for independent social care services in the UK. I am now going to hand over to Martin. Thank you very much and good to see you again, Martin.
Thanks very much, Kathryn. And can I thank Care Talk for putting on this conference, which I think is well timed. I noticed that this conference is called the Preparing for the New Normal. Well, I sincerely hope that the new normal will be different from the old normal. We've learned a lot of things during the COVID pandemic about the importance of social care. We have shown that social care is really vital, not only to the people it supports, but it's part of national infrastructure. And we need to move forward with a clear agenda about how we're going to make it fit for purpose in the 21st century. And Damian made some really good points about how challenging and difficult it is to get politicians to engage with this issue. And I think, he made the point that we've been talking about it really for a quarter of a century. But I do think now is a moment when we should push forward with the reform agenda and create a new vision for social care. It's my hope as well that the social care sector itself will lead a lot of this agenda. You will see on this slide that Care England is, as Kathryn said, a representative body for care providers. We have, of course, got a lot of care providers in membership. They represent both small, medium and large. They're from charities and corporates and independent providers. Our members support people who are older, people with learning disabilities, people with brain injuries, and also people with mental health conditions. So I think what we can see is how the agenda is developing across the entire sector. Damian made the point that we must make sure that the reform agenda is inclusive, so that it's not only about older people, but it's about all people who are supported by social care. And it should also recognise that continuum of care. As Damian said, there are lots of people who are being supported in their own homes, as well as people in residential care. My view is there is room for all parts of the sector. But I do think we need to also think about how we develop our model for the future. Can I have the next slide, please? While I talk about the future, I really want us to see a new vision for social care. Currently, social care is not well understood by the population, and Damian made that point very eloquently. The challenge is to get people to understand what social care is about. But I also think we need to make sure that social care is seen as something positive rather than something negative. Now, currently, the problem, one of the big problems, is that you only get social care when you've gone into a crisis. Now, I think this new vision for social care needs to focus on people's assets, not their deficits. And it needs to be very integrated into a prevention agenda, so that what we see is social care that supports people to live well and also maximises their potential for independence, choice and control. And I do think that we're a long way from that. That's not to say social care services don't give people good lives, give them good well-being, but the way in which you access social care is very much on your deficits, not on your assets. And I think we need to flip that over. I also think we need to be really clear that this has to be personalised and also co-produced care. One of the challenges when I talk to people who are receiving care, they talk to me about how they feel that things have been taken away from them, that things have been taken out of their control, that decisions have been made that they have had no part in. So I do think the new future needs to be about co-production of care. I also think we need a great deal of innovation. Damian mentioned technology, and I'll talk about that in a minute. But I do think as well, we need to think about the models of care we have, and we need to see how they can be developed, flexed, innovated to be more appropriate for people's needs in the 21st century. Of course, we talk a lot about integration. And the first thing I want to say is I want to reclaim the term integration. Too often it's talked about in terms of the NHS, care providers, local authorities. Now, in my view, that misses the point completely. True integration is about how people experience services. You know, I use the example, when I get on an aeroplane, I do not know when I leave Austrian airspace and go into German airspace. There is a massive process going on in the background involving lots of different organizations. But as a service user in that context, I experience a flight from A to B, and I judge it on my experience. So I think we've got a long way to go to reclaim integration and to align the measures of success right across the system. We've also got to do something radical around how we support this fantastic workforce that we have in social care. You know, Damian mentioned how incredibly difficult and challenging the last year has been, last year and a half actually. And I think the workforce have really shown themselves to be consummate professionals. We always knew they were, but now of course they've had higher profile. So what I want to see is I want to see that higher recognition transformed into some very clear skills and competency frameworks. I want to see some qualifications that are portable. I want to see career escalators so that people know they are building a career in social care. The chair of the Health Select Committee, Jeremy Hunt, has called for a 10-year workforce strategy, and I really want to endorse that. We have got to have a workforce strategy that enables people to be recognised and rewarded as the professionals that they are. And never again do I want to see social care professionals paid on the basis of a minimum wage. They have got to be regarded as professionals. I think we also need in this future vision a bit of a revision of the regulation system. I think the current system is too much about identifying challenges and problems and sometimes pointing fingers. What I want to see is a regulation system that learns from experience and cascades better practice into the whole sector so that we can move to regulation that is about improvement rather than just about particular services. There is a real desperate need for us to embrace technology, and I will talk about that shortly. But I think technology will be one of the most important elements of driving forward our 21st century care system. But I want to be really clear here. When we talk about technology, the first outcome must be improved services to the people who use care. There will also be outcomes that will be improving efficiency, etc. But I do think we can use technology and also data to transform our current system. Well, of course, we have been waiting, as Damian said, for 25 years and more for that new funding settlement. What I really want is a settlement that will be fit for purpose and be long-term. We've got to clarify for the citizen what they might have to contribute, but they've got to also know what the role of the state is in that. I also think our new vision is going to require a degree of capital investment. And what I would say is we are in an economy, a global economy, where we have gone through COVID, and that's had huge economic impacts. So one of the things we can't do is continue to snipe at people who want to invest in care. The people who want to invest their money in care are going to help us to embrace a new future. And I think we've got to accept that, and we've got to welcome them, because we will be competing with others for that very, very needed capital. Next slide, please. Well, I think technology is going to be really important as a solution. And many of my members are already embracing technology, and they're finding that it is improving the quality of care that they can offer. It's also differentiating them from others in the sector. I think also technology must be about driving up quality. You know, one of the things that I think it will help us to do is be much more proactive and improve care. I'm really interested as well in some of the technologies that, for example, can give data about how people's conditions are changing, that will enable the colleagues in the health service to put in proactive medicine that will stop people going into crisis. And we have the capacity to do that. I mean, many of you who are listening to this will be wearing their Fitbits, and that is transferring data to you about how your day is going, you know, your heart rate, how many steps you've done. And we need to use some of that technology to be really proactive for the individual, improve the proactive care. And I think it will also be important to make sure that the technology is integrated across the whole system. You know, one of the challenges that we have at the moment is systems are in particular silos of health, social care, different providers, etc. Well, technology might be the way in which we bring those things together. Next slide, please. If we're going to get to our aspirations into some kind of delivery, we need to start capturing the value both of innovation and also of technology. One of the challenges is that we often don't identify what these interventions have delivered, both in terms of the improvements in quality of care for the individual, but also the data sets that will help us to plan and develop our future system. And again, this is another area where I think our new normal needs to focus, which is about how we use data. And data will drive our development and also improve our efficiencies. It's been a big disappointment to me that social care has not been in the vanguard of the productivity challenge, for example. And people have always said to me, but we're a person-to-person sector. We can't look at technology taking over from what people do. Well, I reject that. I think there are some things technologies can do that will enable people to have much more autonomy and choice within their services. And that will leave the skilled and able staff that we have to be able to do the really important person-to-person work. But technology is going to be important in the future, and we should stop being Luddite and we should embrace it and be positive about it. Next slide, please. I think what we've got to do is we've got to look at a reform in terms of the vision of social care. And I want to go back to that point I made at the start of this presentation. I do not want the new normal to be a version of the old system. I think this is our moment in history. We have had COVID, we have identified some of the challenges, we've identified the way in which services haven't been integrated, haven't necessarily worked very well together. And in this reform of the new normal, I think our new vision has to be absolutely the starting point of that. And I really want to stress that if we get the vision right, if we know what we're trying to achieve, we can then work backwards and we can start to identify how much it will cost and also frame it in the context of the changing landscape of technology, which will deliver efficiencies and enable us to deliver good quality outcomes for the people who use services and do it in the most efficient way. We've also got to get governments to lead some of this agenda with a long-term sustainable funding settlement. And we just have to have that. I was really pleased to hear Damian say that he felt that this would be in the next spending review and in the government's programme. And I know people like Damian and I know people like Barbara Keeley, who's also speaking at this conference, have worked absolutely tenaciously over the years and have put aside politics to try and come up with a workable solution that's in the best interest of citizens. And I really think more power to both their elbows. And we as a sector need to be really clear about supporting them, but also clarifying our asks and giving people the knowledge of what we do, the impacts we have, and what we're achieving for citizens. And I think all too often we have not been very good at doing that, but I think technology will help us. I really hope as well we will start to use data in a much more effective way. And our data approach will be about how we plan for the long term and how we make the most of that data to enable us to be proactive and to reduce people's dependency. I think also that technology will deliver a really great audit trail for regulators, for service users, for families and relatives, and that's really important. We've not only got to do what we do, but we've got to provide the evidence to a range of people that we've done it well, and that we've made a difference. And I think I want to finally say, our focus has got to be on the people who use services and on our staff who deliver them. And our focus can no longer be about administration and process. What we've got to be is about people and outcomes. And if we move to that as our new normal, I think the sector has a very, very bright future. Final slide, please. And that's all I really want to say, Kathryn, but I certainly in the question and answer session really welcome people's views, opinions, questions, etc. And again, want to thank CareTalk for developing this conference. Thanks, Kathryn.
Excellent, thank you, Martin. And I don't think many people could disagree with any of that. Really, really insightful. And let's hope we get some of that in the spending review, as you mentioned. So yes, if you want to ask any questions, I can see there's a few questions coming in, which is good. Remember the question and answer box there. And next, I'm going to introduce our next speaker, Barbara Keeley. Barbara has been MP for Worsley and Eccles South since 2010 and represented Worsley from 2005 to 2010. She's currently a member of the Health and Social Care Committee and Vice Chair of the APPGs on Ageing and Older People, Learning Disability and Social Care. Many thanks, Barbara, and over to you.
Thanks, Kathryn, and thank you for inviting me to speak today. As Martin said, it's a very good time to have this conference. Been invited to talk about creating change for the new normal in social care, but I want to just focus first on the old or previous normal, because we were, even before the COVID pandemic, in a state that was deeply worrying, certainly to me. The sector was actually said to be in crisis before the COVID-19 pandemic, with provision described as continuing to be very fragile. And there are many indicators of this fragility. There are not enough social care staff. In a sector with 1.6 million jobs, there are 112,000 vacancies and a turnover of 30%. Now that's hardly a surprise, given that 1/4 of the jobs are 0 hours contracts and the median pay is only £8.50 an hour. Staff can earn more in local supermarkets than providing vital care in many places, and that's wrong. There's a persistent problem with the quality of care in a small number of places. A number of care services are described as struggling to make any improvement, and those adult social care services represent 11% of care home beds and 8% of community care services. I believe there's a human cost in continuing to fail to address the crisis in social care. Damian has talked about how parties have grappled with this for the past 25 years, but we now have a great deal of unmet care need. That figure has been estimated by Age UK at 1.4 million going without the support they need every day. And that has risen, it's estimated, to 1.9 million people during the pandemic. And that is also pushing a burden of care onto the estimated 13.5 million people across the country who provide unpaid care. And nearly a third of that number didn't provide unpaid care 18 months ago, but they've had to pick up where formal services were rolled back during the pandemic. As we know, there is a funding gap. There are a wide variety of figures for this. The Association of Directors of Adult Social Services point out that they've had to make £7 billion of savings in social care budgets since 2010, despite rising demand. And they were to make further savings of £700 million before the COVID pandemic started. The pandemic itself has only deepened those problems. As an MP, I've seen firsthand in my own constituency how some parts of the care system have struggled over the past year, although it is worth saying, and I want to say at this early point, that I think the care sector and the care providers in my constituency have been absolutely heroic, and I particularly want to mention the care staff. As has been widely reported, certainly in the early stages, care providers were unable to get the PPE they needed in the early stages of the pandemic, And I know that care staff had to queue in local supermarkets to ensure that care homes had enough food. We shouldn't have been in that situation. Unpaid carers, I talked about the 13.5 million unpaid carers, have often struggled to cope in a year when services like day centres were closed. So overall, it's a deep sadness that the failure to protect social care meant that 30,000 care home residents died with COVID-19, along with thousands of people who used domiciliary care who died as well. Some care homes lost half their residents during outbreaks last year, and that's quite a shock to the system. And none of that was inevitable. If we had a robust care sector, well understood by government and the NHS, and given the support it needed from day one, it would have coped far better. I think it's fair to say, as our other speakers have already said this morning, this knowledge and the exposure that the pandemic has given to social care have created a unique impetus for change in the social care system. The problems that I'm talking about, we've all known about them for years, but now they've been forced into the public consciousness. And so this is a good time to plan for change, to create a new normal. As Damian touched on it, but it's now been nearly 11 years since Andy Burnham published a social care white paper, and that would have implemented wide-ranging reforms and moved us towards a model of free personal care. In that time, we've had nearly a dozen broken promises from the government on social care. And this started in 2015 when the government dropped the cap on care costs, which they had put into law only a year earlier. While this cap was far less generous than Andrew Dilnot's commission had proposed, it would have been a first step towards a fairer social care system. And we've got people putting comments in the chat about how unfair the current system is. A replacement proposal in the Conservatives' 2017 manifesto lasted only a few days before it was dropped, as Damian referred to earlier. Since then, we were promised the government would bring forward reforms in late 2017, the middle of 2018, autumn 2018, the end of 2018, and April 2019. None of those deadlines were met. Boris Johnson, of course, claimed he had reforms ready to go when he took office. Then he repeated that claim during the 2019 election. But now we're nearly 18 months later and still being told to wait for the government to bring something forward. 10 missed deadlines in 5 years. To me, that isn't just a frustrating sign of political inertia, it's a failure of government to hold up its end of the social contract and its manifesto pledges. Because I think it's widely recognised in Westminster that the current social care system isn't working as it should, and the COVID pandemic has added to the challenges, particularly on funding. The additional costs of the pandemic are estimated at 6.6 billion, against access to government funding for those costs of only around half that. Given the consensus that exists, it's difficult to see why the government has been so slow to bring forward any concrete proposals of their own. Obviously, there is concern over the political fallout, from Labour's 2010 proposals being labelled a death tax to the 2017 Conservative manifesto's proposals being called a dementia tax. There's a history of making political noise out of social care reform proposals. I agree that we do need to have a serious conversation about change and reform in social care, and not to vilify proposals for the sake of it, but we must scrutinise whatever is proposed. We can't be so desperate for reform that we accept it if inadequate crumbs of change are offered, or if more sticking plasters are offered for funding. If we do, we are letting down the people who rely on social care services. We need to be pushing for broader reforms than just the focus that the Prime Minister has expressed at times on stopping people having to sell their homes to pay for care. Dealing with the catastrophic costs of social care is important for hundreds of thousands of people, but it is only the tip of the iceberg when it comes to reform. For any reform to be sustainable in the long term, there are 3 other things I think it must deliver. First is increasing access to social care. There are nearly 2 million people who need help and support but aren't getting it. This unmet need is putting more and more pressure on unpaid carers, who are often pushed into taking on caring workloads or personal care tasks that they may not be willing or able to tackle. And it is disturbing that the unpaid carers' role is so ignored that the Health and Social Care White Paper does not include a single mention of unpaid carers. We cannot continue to take their role for granted. They should be partners in health and care. And the sad reality is that those who can rely on unpaid care from a friend or family member are the lucky ones, because going without care fundamentally means being unable to live the life you want. This is the problem that options like free personal care are aimed at. By expanding universal services to everyone who needs them and funding them so that eligibility levels don't creep up, we can begin to tackle the problem of unmet need. Second is ensuring that care supports people in all parts of their life. Help with basic tasks like washing and dressing must be at the core of support, but we cannot allow this to be the limit of our ambitions for people who need social care. The Health and Social Care Committee, of which I'm a member, recently heard from the campaigner Anna Severite, who told us, "I feel I'm not able to live a normal life. I do not have enough hours of care to be able to go out at the weekends and in the evenings and to do a lot of the normal things that make life worth living." People who use care deserve services which support every part of their life, rather than a system which breaks them down to a series of 15-minute tasks to be ticked off on a list. All too often, social care services cannot afford to treat people using social care in the round. And one of the worst examples of this can be found when people with learning disabilities or autistic people are denied holistic community support, and the only alternative offered to their families is protracted stays in inappropriate hospital inpatient units. Changing this requires more than just additional funding or tweaking with finance models. It requires a shift in culture. We've already heard about the need for a new vision for social care. We need care services that start from a position of looking at what people want to do with their lives and work back to establish what support they need. Now, the Care Act could have moved in that direction with its focus on tasks which went beyond personal care. But then with budget cuts piled more onto cuts meant that the ambition was never realised. Finally, and underpinning everything else we do, is securing a fair deal for care staff. If the crisis of the pandemic showed us anything, it was that without the hard work put in by care staff, the care system simply wouldn't work. But too often, care staff are underpaid, undervalued, and given few opportunities to progress. To fill the 112,000 vacancies we have for care staff, social care needs to start to become a career of choice with better pay and conditions and better training. When the average starting salary for care staff is around 16,000, it is little wonder that people are not turning to a career in social care. As a starting point, reform should mean that all care staff are paid the real living wage, as my own local authority in Salford is now doing. But going beyond this, we need to see investment so that the social care sector offers training opportunities and real career progression for staff, recognising their skills and experience. If we are to fill the vacancies in social care, we will need a wide strategy working across government departments to recruit and train the workforce we need. And as Martin has said, we need a workforce strategy for social care as we have for the NHS. Adverts talking about how fulfilling care work is, or the promise of a care badge as recognition, simply don't go far enough to encourage people into the sector. And expanding the care workforce has to be a key part of recovering from the pandemic. The changes in our economy over the last year have sadly seen hundreds of thousands of people lose their jobs. As work patterns change over the years to come, it is likely that some staff who have been on furlough will discover they don't have roles to go back to. But the government's current approach often leaves people in this impossible situation to cope on their own. The current skills guarantee means that anybody who has at least one A-level or equivalent qualification is unable to access the funding to retrain into a new sector like social care, and I think that should change. We need more people working in social care, and we need them to be trained to deliver the high quality care that they are aiming for in care as a career of choice, and achieving this will take real investment. If the government can deliver all of these in their proposed reforms while also ensuring that the system is funded so that people don't lose their homes to pay catastrophic care costs, they will build on that existing consensus that I talked about. Now, we know that the truly difficult part of social care reform is how it's funded. The reforms contained in the Care Act would have been promising before the proposals were actually dropped by the government, were it not for the fact that they came alongside sharp cuts to local authority budgets. The Treasury's reluctance to give the social care system the funding that it needs has contributed to years of decline. I think it's one of the major factors behind the constant deferral of action from the government. Over the coming years and decades, we're going to see the NHS take up an ever larger chunk of public spending if we want services to keep pace with demand and deal with the backlog caused by the pandemic. But demand for social care will also continue to rise. Although the pandemic cut life expectancy in 2020, the percentage of older people in the population has increased steadily for decades, and the number of people living with a disability is predicted to rise at more than 2% a year. Long COVID may also create further demands for social care, given the debilitating conditions that many people with long COVID are experiencing. With this greater demand for care services, my concern is that the Treasury will fail to prioritise spending on social care. I think that would be a mistake. To me, this is a question now about what kind of country we want to be. Are we a country which is happy to let older and disabled people waste their lives because they can't get the right support to live the fulfilling lives that we all expect and deserve? I think we've all seen over the past year that isn't what kind of country we are. When needs arose, people have come together in their communities to support one another through great difficulty, even when it's put them at risk to do so. The government has an opportunity now to seize the public mood and take action to fix social care. We all need to keep pressure on them over the coming months and years if necessary, so that taking action becomes the path of least resistance for the government. And as Directors of Adult Social Services told us in their latest report, doing nothing is not an option.
Thank you very much, Barbara. I certainly agree with that final sentiment. We've really got to grasp this nettle now while we've got more of the public's interest than we've ever had before, I think. We've now got some time for some questions, so I'm going to put some questions to each of the three panellists we've just had. And we've got quite a few questions, and we've probably got about 10 or 15 minutes, so we'll see how many of them we can get through. The first one I'm going to address to Martin. So Martin, when we say that we should move to a preventative care model, how can this happen with the payment models are set to pay a fee for service? Most innovators find it hard to reach decision makers. What are your thoughts and how can we accelerate this transformation? And that's from the Thrive community.
Well, I would agree. Part of the problem is the current way in which we fund social care, which is funded on the basis of process and bureaucracy, not on the basis of outcomes for people. So I think we've got to change that. And in our approach to how we revision social care, that has to be changed. I also think, you know, with the advent of technology, there are ways in which we can be much more proactive. And I particularly like the idea of co-producing care, because one of the things that I've noted over the years when I've talked to people who use services, often they are not getting what they want. And sometimes what they want isn't the big, enormous service. It's the small things that make a difference to them. And I think in the future, we've got to start co-producing care. We've got to change the funding model. So it's about delivering funding for the outcomes that people achieve and the satisfaction that service users feel they get from those services. And so I think, I agree with Thrive. We've got to change that model that we're currently in, because if we keep that model, we won't get to the new vision that we all want to see.
Yeah, I agree with that. Thank you, Martin. The next question I'm going to give to Damian. So Damian, this question's from David Black. David says, since May 2017, I've slowly been handing over my mum's assets to private residential care providers due to her dementia making it impossible for me to look after her at home. Others in mum's care home get all assistance and social care provided for free. Planning for my financial future, would it be better to make sure that I'm totally reliant on the state before I get my dementia diagnosis?
Yeah, I mean, that's David is quite right. That is a central unfairness that some people observe in the current system, and for everyone, there is a huge amount of cross subsidy between privately paid patients and patients is the wrong word, residents who are being completely paid for by their local authority. And getting away from that is one of the central difficulties of how you devise a funding system. It's why I use the analogy in a paper I wrote for the Centre for Policy Studies a couple of years ago about this, of one of the successful models, actually successful in terms of establishing a proper cross-party consensus, as well as actually providing a more stable system, is the pension system, where we have a state pension, but on top of that, a huge number of people save for a private pension, and that analogy moved over into insuring yourself against the potential for care costs. Seems to me to be doable. Where it's difficult is what are you getting for the insurance policy you've taken out. Why shouldn't you adopt the sort of, if you like, the sort of, I'm going to just depend on the state, so I'm going to spend all my money that, you know, that David postulates as a way of doing it. And so you have to say that, you know, whether it's you know, better rooms or something like that, obviously you don't want to affect the basic care. That needs to be at a decent and good level, a better level than we often provide now for everyone, even if they are entirely reliant on the state system. But you know, there are extras you could conceivably buy if you can have that sort of insurance policy. But that's, you know, I'm conscious of the sensitivities of all of that. So that's one of the issues that, frankly, successive governments have grappled with over the years. You know, because the alternative, you might say, well, okay, the simplest way to do it is just to have a national care system, just spend it all money from the state. And I think the problem with that would be that attempts to integrate that with the rest of the NHS, which is one of the things we need, and also integrate with other local authority services, would be much more difficult. And that in effect, if it was part of the NHS or sort of subsidiary of the NHS, it would become the new Cinderella service, because it would never be as dramatic as waiting times at A&E or new hospitals or cancer waiting and things like that. And I really think that although we all agree the care system needs to be more integrated with the health system, that actually turning it into part of the health system would actually make the situation worse. So we've got to find some way of people to get something for something they contribute in terms of an insurance policy or straightforward payments.
Thank you, Damian. That's yeah, interesting view. So another question from Jane Blackwell here, and I'm going to give this one to Barbara. So Barbara, Jane says, as well as a cross-party approach, how much do the media play a role in educating the public, as their headlines can kill initiatives off before they've started? Dementia tax and death tax being just a couple. How can we move on for what is the best of the whole nation?
Well, I think, as I said, and I think the other speakers have said too, that we are now in a good position to move on, because we have had an incredible focus in the media over the last year. I mean, I think we were at a stage where night after night after night on the evening news, we were seeing care homes and staff who work in care homes and care home managers and become familiar with their issues. Admittedly, that was because of the pandemic. It was the pandemic that we were talking about. But I think it brought home to people just how valuable care is and what a wonderful job care staff do. And I think that's a good position to start from, because it started to be something that people have had to see as, you know, I mean, Martin said, part of the infrastructure. It is part of our infrastructure in the same way that the NHS is part of our infrastructure, and it should be. But I think we need to move away from what has been, you know, a very horrendous year, an awful time for parts of the care sector, but hold on to the wonderful view that people have formed of how valuable that care is. I think that makes it easier for politicians in a way, because I think, as I said, the funding of you know, expanded services, different services, has always been the sticking point. I mean, I think Damian probably would probably agree that the Treasury is often the sticking point in coming up with funding for reform. And if it's something that's important to the whole country, then I think that's, you know, we've got a much better chance of doing that. But we do need to bring around, I mean, central to all of this is the thing that both Martin and I discussed, that we have to change the culture, and we have to get away from it being a process. That, you know, that care isn't just visiting somebody and giving them 15 minutes of care and then leaving. It's you know, what they need for that day, and we have to redesign care and change the culture, as well as you know, recompense and change our view of the role of care into being a career of choice, with a workforce that we value and that we pay well and that we train and that we have career progression for, because we won't get the quality of care that we want while we continue to treat, you know, 1.6 million roles, care roles in the sector. We have to treat that as important as we treat the NHS.
Absolutely. Thank you, Barbara. In the interest of time, Martin, I'm coming to you next, but I'm going to give you 2 questions and merge them, if that's okay. So the first question is from Richard Buckle, and he says, Martin, thank you for your presentation. You mentioned social care should be seen as something positive and not something negative. Do you believe we can achieve that? And I'm going to combine that with Kevin's question, Kevin Minier, who says, are the panellists confident that social care providers and service users carers will have a real voice in the integrated care systems and within future commissioning?
Well, I think it's going to be a tough challenge to redefine care, but I do think that, Richard, we've got to start thinking about this in terms of being much more on the front foot as care providers. So we need to be telling people exactly what we have achieved, and also we need to get not only care providers, but we need to get the people who use services and their families to be our champions. It's really interesting to note how brilliant the PR of the NHS is, and people think they understand it. Of course, they think they understand it because they think you're diagnosed with something, you go into a hospital, you come out cured, and the reality is very different when you've got a long-term condition. But I do think we all need to be on the front foot, and it links also to the question that was asked to Barbara about where the media positions itself. We need to have everybody understanding what social care really does. So I think that's going to be one of our challenges for the future. Kathryn, can you remind me of Kevin's question again? I'm sorry,
I can. So Kevin was asking, are the panellists confident that social care providers and service users carers will have a real voice in the integrated care systems and within future commissioning?
The answer to that, Kevin, is no, I'm not confident. And I've seen so many of these new initiatives come and go. I'm old enough to remember things like PCTs, we had joint appointments, and none of them changed. And partly, I think it comes to something Barbara Keeley was very eloquent on, which is about culture change. You know, we can change these structures as many times as we like, but we need culture change. And if you look at these ITCs and these new initiatives, very few of them have got provider voices on them. There's not very much clarity about how they're going to hear the real voices of users. And I think also I want to say about how we engage people who use services. I'm frankly sick of the tokenistic approach, which says, oh, we've got a service user on this committee or the other committee. What we need to do is capture people's experiences in real time and say, what does that mean for the service and what does that mean for the future development of it? So in short, Kevin, sadly, I'm not very confident. And I think we're going to all struggle to make these new systems work to change the culture.
Thank you, Martin. Okay, next question to Damian, please. Anne-Marie Perry asks, do we think we can afford to tackle the problem of unmet need? It's all very well to talk about unmet need and unpaid workforce, but the budget needs a major overhaul if the government truly wants to affect change.
Yeah, I mean, I completely agree. And what has happened in recent years is that every year, until we come up with a new stable solution, the government bungs a few billion to local authorities, and that gets us through the next 12 months. But that's no way to continue in the long term. So yeah, absolutely, we need more money. And the interesting question is, how do you get that money? Do you just increase national insurance, have a hypothecated national insurance, 1% or something like that, which is what they do in some other countries. The Germans effectively do that, or maybe you do that, and on top of that, you create an insurance market if you can. There are various technical difficulties, like the relatively small number of people who have absolutely colossal costs. You would need, I think the state would need to insure them to ensure that there was an insurance market. Otherwise, nobody would insure anyone. And you need to make sure that not the only people who take out insurance are those who already know they're likely to need care. So you've got to. It's not easy, but you could do that as a way of getting extra money in. As I say, you could increase national insurance, but either way, you are going to have to do something like that. And if I can just, while I'm on, I'm slightly more optimistic than Martin actually about the ICSs, simply because they will have to involve local authorities. So it won't just be the NHS on its own, which is what we've always had in the past. Local authorities will be there, and they will obviously have their own direct interest in the care sector. So there will be a care voice around the table. But also, having said that, you need other things. You need providers and users as well. to be sat around that table to give a proper voice to the care sector, but it's certainly being designed in a way that it accepts that it's got to be integrated across the, if you like, the traditional NHS and care if it's actually going to work.
Great, thank you. I'm going to just bring one last question to Barbara. Barbara, quickly, if I could just ask you a question from David Brindle. David says, can care commissioners and providers unite around a plan for the real living wage to be the sector minimum and jointly set a date for implementation? My question to you, Barbara, is do you think this could force the government's hand on funding?
Well, it should do. I mean, we shouldn't be in a situation where we, as I mentioned, the large proportion of care staff with 0 hours contracts and not getting the real living wage. I mean, a number of local authorities have taken the initiative, and mine is one, to pay that. But of course, we're talking about often people with years and years of experience who deserve an awful lot more than the real living wage. I mean, we've got to look at a career structure and a pay structure that suits that role. And I think that so I do think it's a first step. The real living wage is the first step, but it's only the first step, and we've got to start to be much more serious about turning this into a career in all the ways I outlined. And on the point that Damian's just made, really, I think we've got. It's a difficult thing. This 2 points to make. We don't want any more sticking plasters. I think if we get to another autumn and we hear of a small amount of sticking plaster of funding for the sector, that will not be good enough, particularly with the year that the care sector's had during the pandemic. So we do need more money. But I think we've actually also not got to get into a situation where we have decades and decades trying to come up with the elegant solution that fixes everything. Some changes have got to be incremental. So maybe that the point that David's made, regard the real living wage as a first step, but it absolutely has to be only a first step, and all the other things I talked about for the workforce are important too.
Great, thank you, Barbara. We've still got quite a lot of questions there. I'm sorry I don't have time to come back to them now. We might have time to come in the second round of questions, and if not, we'll see if any of the panelists can answer them in the Q&A boxes. In the meantime, I'm going to move on to our next panelist. So now I'd like to introduce Gary Bowley. Gary has been a self-advocate for over 30 years and is co-founder of Learning Disability England. Before this, he founded People First England. Gary has a vast amount of experience in working with the media and has appeared on Channel 4 and in The Guardian. He's a civil rights campaigner and brought the People First movement to England. He's now Membership and Engagement Lead at Learning Disability England with extra focus as self-advocate spokesperson. Over to you, Gary. Thank you. Are you there, Gary? You're still on mute.
I should know how to use it.
Thank you, Gary.
Thank you for that introduction. Yes. Can next slide, please? Oh, Sam will be with me as well. She should be here as well.
I am here, don't worry.
Oh, there you are. We'll be talking about how experts by experience can be at the heart of the new normal. And I think that we're going to get used to that word, the new normal, different from the old normal. And this is, next slide, please. Learning Disability England exists to make life better for and with people with learning disabilities and their families. We work alongside our organisations and they the service provider organisations. So we've always been sort of separated in the past, doing our own thing. But Learning Disability England is trying to bring all these different groups together. Not easy, because they've been in conflict with one another in the past. How it works? Well, we've got a membership. that for people and organisations, creating stronger links together. We plan together, work together, because we feel that we're stronger together. And we influence and can do campaigning, speak up and share others' important work, especially with other self-advocacy groups and parent forums that who do different types of work. We solve problems together and share what works, you know, what doesn't work. And we share information and build networks, so we learn together. That is how we get ourselves to be more educated. Next slide, please. What we have learned, many people have adapted. They've been learning a lot to use technology. A lot of people with learning disabilities use Zoom as better than Microsoft Teams. Microsoft Teams seems to be much more harder to use than Zoom. Zoom is much more easier to learn, and we have a lot of our members who use that technology. Recently, we had a big AGM conference where with about, I think it was about 250 to 300 people attended our AGM, and that was a great success. It was the first time we've actually done a conference online, and everybody attended that, wanted more of those kinds of conferences, technical conferences. The self-advocacy groups and organizations supporting members in new ways. We're actually, a lot of the self-advocacy groups in the past were working separately, but we're just during this pandemic, as we've been using Zoom, we have had lots of self-advocacy groups communicating and working together to find new ways to get through this, through the pandemic. Well, there's been online activities and events, as I said. There's been conferences, and there's been activities like quizzes and music and doing exercises online, and a lot of the different self-advocacy groups have been doing that to keep their members, you know, not from being lonely, because loneliness is a big killer for people with learning disabilities and autism. Some of the changes are good, like less stress, and that's one of the things we've been doing. Next slide, please. Oh, is this you, Sam?
I think it is me, yes. Hi, everybody. My name is Sam Clark. Gary asked me to co-present with him. So, as Gary said, Learning Disability England is about bringing people together. And I guess part of the reason Gary wanted to tell you about this at the beginning is we think we need to hear from everybody's voices and not just the commissioners or the providers, but actually people themselves, but also working it out together. And one of the things we've learned is that many people and their supporters felt forgotten. And so for lots of disabled people, they've told us that the policies and the processes didn't work. They didn't work for the way that lots of people with learning disabilities live. They didn't work for different kinds of supported living. It took longer for that to get to work. And we also heard from a lot of people about, you know, what the impact of services stopping or changing radically. And that's the same for paid supporters and people with learning disabilities, but also family members. So we've heard a huge amount about the impact of the sense of our current policy systems and processes not thinking quickly enough about the way that many disabled people live their lives. I think I'm handing back to Gary now, because we want to talk a bit about what we think the opportunities are for making sure that people are at the heart of how things work. So can we have our next slide, please?
Yeah, thank you. Yes, do not plan without us being part of it. So in other words, nothing about us without us is our big motto for the people with learning disabilities. It is easier to work together online now than it was at the beginning. As I just said about, we're doing more of these conferences and doing more workshops, and a lot of people are getting more into this. There's a lot of people who wouldn't be able to attend a conference in another part of the country because of mobility situation. And we can easily include more people with learning disabilities and their families. And we all hold some of the solutions to making things better. For example, how we come out of so something coming across my screen. That's
It's the bit about lockdown, Gary. Yeah, you got it.
For example, how we come out of lockdown will be really personal to us all, and can mean we change our support to work better. We've had a lot of people with a lot of self-advocates saying what they felt during the lockdown and how difficult it has been without the support, without people being there, and without the technology of using the Zoom to talk to people. People will feel a lot depressed and a lot lonely. You can actually see our self-advocates talking about this on our latest news coming out, www.learndisabilityengland.org.uk news, latest news coming out of lockdown. And a lot of the people want easy to understand information, which is very, very important. A lot of our self-advocacy groups have actually translating lockdown material from the government into easy read, and it's coming out of all their funding. And it shouldn't be the self-advocacy groups paying for this. It should be the government paying for this and making easy read information about lockdowns and bubbles and things like that. They should be talking that in easy read information. And also we're getting all this information a bit too late. Then, and we're getting sort of getting further behind. And it's important that you take us seriously, and also don't make it all in a hurry. Slow down and be at our own pace. Next slide, please.
Oh, it's me again, isn't it?
Is it you again?
I think it is, yeah. So we were asked to talk about experts by experience at the heart of the new normal, and actually we think it's really important, and we support what Barbara and I think Martin had definitely said about a culture shift, about doing things really differently. And we would say that actually we have to start all of this now by planning and acting together. So like Gary said, don't make plans without people. And I can't remember listening who it was that actually said it, but often people, our experiences, people are being asked to provide or to have services that are not quite what they want, and they don't want more, they just want something really different. So we would say start with conversations about what matters to people. So Gary gave you that example about having a look at what some people with learning disabilities and autistic people are thinking about as we come out of the next stage of the roadmap to things changing. Well, actually, you know, rather than starting with just a conversation that says, tell us your experiences and then we'll decide what we do, we think what we need to do is have people around the table talking about all their experiences of being a provider of support, being a commissioner, being somebody's family member, being a person who supported themselves, and then working out what we think we need to do together. Because that way we think we'll come up with the best solutions. And we think we can learn a huge amount from things like how community groups have responded through the pandemic, who've provided lots and lots of low-level social care to people or stepped in when services couldn't at the very beginning. And what they did was they worked it out with people based on what really matters. And we think that is the culture shift and the focus of an outcome that we'd really like to see, I think. Is that right, Gary? Have we done a bit now? Is that on?
And for some self-advocates, they are saying they can't understand the difference between what COVID-19 is and coronavirus is. They think they're two separate viruses. So please explain what you know, that they are one, you know, and give people a chance. Work with us, not against us.
Brilliant. Thank you. I think we should end there, don't you?
And then we hope this is useful.
Thank you so much, Gary and Samantha. That was incredibly useful, and there's quite a few questions coming up in the Q&A box for you, which I will bring to you when we finish with the next couple of speakers. So on that note, I would like to move to introduce our next speaker. Our next speaker is Mike Padgeam. Mike has had 32 years in social care and is a leading and influential figure in the sector, looking after our oldest residents. Mike is Managing Director of the growing family-owned and award-winning St Cecilia's Care Group, which owns 3 care homes, a nursing home and a day centre in North Yorkshire. And since 2001, Mike has been Chair of the Independent Care Group, a representative body for care providers in York and North Yorkshire. Over to you, Mike. Thank you.
Thank you for that introduction, Kathryn. And it's good to speak to you from sunny Scarborough today. Well, I think it's good to speak. These virtual conferences can be a bit unnerving, really, is that I hope that you're still out there and still listening to me. Otherwise, I feel like I'm talking to myself. Funnily enough, that's a bit like, not a new phenomenon for me, really, because I felt like that at the beginning of the pandemic. Is actually, was anybody listening, at least in government, to us? But a little bit more of that later. It's great to share the platform with such exalted company today. I think the speakers we've had have been excellent, but I particularly like the bit that Gary and Sam mentioned a few minutes ago about do not plan services without us. And I think that is a very important factor for all of us. Plan involving people that use services is critically important. So what I'm going to say today really is not the result of endless papers, research and think tanks, but it's more based on common sense and my experience in the front line for many, many years, 30 plus years. So as Kathryn said, we are a small family provider, 3 care homes, nursing home, daycare, and just started again in domiciliary care. And for my sins, I've been chair of the Independent Care Group for longer than I can remember. And I had a decade of chair of the United Kingdom Home Care Association as well. So next slide, please. So I'm speaking today as a small provider, and this is a personal reflection on long-term change that I think is needed. And I am going to be looking forward, but I don't want to forget the past, of course. And I think it was a Spanish philosopher which said, those who cannot remember the past are condemned to repeat it. So I think it's very, very important that we just reflect back a little bit and also look about the road ahead and the need for reform. Next slide, please. So what do we have pre-COVID? Well, as I think it was Damian Greene said and Barbara Keeley said that, we had a perfect storm, didn't we? Rising demand, falling funding, greater regulation. Not that that's a bad thing, but obviously, greater regulation comes costs and staff shortages. A lot of things have been mentioned today over staff shortages, so I won't go into too much more about that now. So we saw care homes closed, home care contract being handed back. And I think it was Barbara mentioned the 1.4 million people who have got an unmet care need. And many of those care homes out there have been at risk before COVID. We know that social care funding was cut by 8 billion since 2010, and many staff vacancies. I think the actual figures might vary a little bit, but my Skills for Care figure shows about 120,000 vacancies on any one day in social care. And the sector generally, that's the independent sector, more the for-profit part, does suffer a bit of a poor reputation. We've got to change that in the future. One of the issues going forward really is about occupancy in care providers' homes. Next slide, please. So we had the pandemic, COVID-19, invisibility for our sector at the beginning. I think not so many people saw that social care was important at the front end. The NHS was in the front line, and it occurred a bit later on that social care was also played an important part. We had the spiralling costs. We still had underfunding. We had falling take-up, and staff really had poor morale. And I want to just pay tribute really at this time, just to thank all those social care staff out there who've done an absolutely fantastic job in the front line, but also just spare a moment to remember those who sadly lost their lives in social care in this last year. Next slide, please. So what kept me awake really? Well, I had a year of not sleeping much really. I wanted to make sure my clients were kept safe. I had the anxieties myself and fears of the clients, staff and their families. I wanted to make sure we looked after staff. We had insurance costs, getting enough PPE and testing at the beginning. Just keeping the business going was the hardest issue. And I took a step, which I'm happy to talk about in questions, of taking in COVID discharge from hospital, because I felt we were in it together, is that we need to play our part so more people could be admitted into hospitals. And that caused a bit of difficulty about me keeping awake at night. And then, of course, restarting visiting. And today is opportune because we start two visitors in care homes from today onwards. That's a big issue. Next slide, please. So looking ahead, 10 years forward, well, often overused word, the reform is long overdue. Better pay for staff. I wish I've been in social care, as I said, 30 plus years. We've been talking about that over the 30 years. We have to do something. And I think it was a question from David Brindle and a point from Barbara Keeley, is we have to address that critically in the first instance. We've got to get more funding in the sector. We've got to make sure the provision is able to meet the demand out there. And I've talked or heard a lot of talking about integrating with the NHS, is I think we've got to do something better. I think it was Damian said that could make it worse about his experience, but I do think we've got to change how we go forward with it. And there can be an exciting future, as Martin pointing out, if we get things right. Next slide, please. What I tried to do myself and from the independent care group is keep the media coverage going in COVID-19. So we did a lot of television and radio and newspaper work to make sure social care wasn't forgotten in there. I think one of the big issues, we have got to keep social care in the spotlight. My big fear is, hopefully, we're coming out of COVID-19 now and more restrictions being lifted. Perhaps the worst is over. I hope and believe we've got to keep social care in the spotlight, because I'm worried that it will disappear off the radar again if we're not careful. Next slide, please. Jeremy Hunt and Damian Greene wrote in the Telegraph not so long ago that long-awaited plan for social care was now or never. We've got to do something. Jeremy Hunt talked about the 10-year plan that's needed in social care. I would just like Jeremy to have done a little bit more while he was Secretary of State on that front. But here we go. Let's just make sure going into the future we can get it right. Next slide, please. So should we revisit Damian Greene's proposal? Well, yes, I think there's some good points in there. I won't go through every bullet point on the slide, but I think we need to make sure we have dealt with it. I think it should be funded by the state. And I think, as he pointed out, it's got to be shared across the whole population. That's the critical bit. It's too expensive for individuals and local authorities. I think there should be a national solution. And my view is a little bit more taxation, a little bit more national insurance. Next slide, please. So this has puzzled me for all those 30 odd years when I've been in social care, is who is actually going to grasp the nettle. Every time I think we get there, I get disappointed. I've been disappointed for a long time, really. So we've had many social care funding reform and white papers, green papers, reviews in the past 20 years. At my last count, we had 13 social care ministers. And I do think social care needs its Nia Bevan moment. There's a legacy there for a politician that won't be forgotten. If we can just do it, I think we need to be very, very bold and do what we did in 1948 with social care. So it's an opportunity, in my view, for someone to go down in history by getting social care done. Now that Brexit's done, let's make social care. If we only could get as much energy into social care done as we had into Brexit. Next slide, please. So there's just an illustration here of all those different papers that we've had. You know, I've lost count, to be honest. Next slide, please. And who's going to be next in the hot seat as the care minister? I think that, Helen Whatley is doing her best in that job, but we need to make sure that the person who comes along next can finally get this done. Next slide, please. I think it was Damian Greene a bit earlier today, talked about Tony Blair. I did that little timeline myself, through Tony Blair to Gordon Brown to David Cameron to Theresa May to Boris Johnson. All going to get it sorted. And here we are. The more things change, the more they stay the same. We've still not got there. We've got to make sure we hold them to account in the future and not let them escape any longer of reforming social care. Next slide, please. So what do I want to see? Well, a root and branch overhaul of the way social care is planned and funded. I believe that bringing the NHS and social care into a national health and care service is the way forward, but that's open to debate. I just think we need to get something done. And I feel that funding for social care through national insurance and taxation is very, very important. I also believe that we should commit ourselves to a fixed percentage of gross domestic product to be spent on social care, so no governments can ignore it in the future. And I think dementia should be regarded as a health issue going forward. I think that's one of the biggest scandals we've got this time. Next slide, please. So I'd like people to be able to save for their own care as they do for pensions. I'd like to see a national minimum rate for care fees. And perhaps, to be bold, we need to look at a new way of exploring social care delivery, perhaps based on a catchment area like GPs. I would like to see a minimum wage for social care workers far above the living wage. I think, as Barbara mentioned, we have to address that issue, because I doubt many people on the conference today would work for the wage that the carers do in the front line. And I want to see the professional registration and regulation of social care staff be mandatory. And I'd like to see the biggest question, I feel, to be positive, constructive to government, is that social care business ought to be zero rated, so they can claim back that cost as other businesses do and take a bit of pressure off local government for funding. I do think that would be a constructive way forward. But so far, my letters and lobbying on that have gone unnoticed. Next slide, please. I'd like to see CQC have much greater powers to oversee commissioning practices, to make 15-minute calls on domiciliary care unlawful. I would like to see that minimum rate coming in for residential nursing care and, for that matter, domiciliary care. I'd like to see less duplication between CQC and local authorities and CCGs on so many hoops we have to jump through on standards. And I'd like to see a greater recognition of the role of the independent sector and utilisation in commissioning and delivery of social care. My feeling is that the Department of Health is very strong on health. I think they've lost a lot of social care expertise in the department. I think they need to get more in to balance it out. I'd like to see more nurse training and bursaries to encourage recruitment as well. Next slide, please. So, campaigning, stand up for social care. Well, I think we need a new hard-hitting campaign to get social care reform underway. It was forgotten at the start of the pandemic, but we can't let it be forgotten again. We cannot afford to lose the momentum, in my view. And care workers who have performed, in my view, absolute miracles this past year deserve better. How come was it in this country, in England, we couldn't give them a bonus, but in Scotland, Northern Ireland and Wales, they got a bonus. I think we should do the same here in England. It's time to stand up and shout for social care, as many organisations do, like Care England do a fantastic job, but we've got to shout louder, because this does affect everybody. Next slide, please. So at the ballot box, well, next local council elections or the general election, let's put a bit more pressure on the candidates, what they're actually going to do for social care. Let's make sure they sign up to something and have to resign if they don't do it. And perhaps we've given the current MPs long enough to change. Perhaps social care providers should stand at the next election in their own constituencies to get social care changed for the good. Next slide, please. So social care, in my view, is given 100% this year and deserves the recognition it's been promised for a generation or more. And I'm reminded of Groucho Marx when he said, "I intend to live forever or die trying." I think that I will end up perhaps dying before we actually get the better deal for care, but I've been campaigning for many years, and it tells you something when I've been accused many times of sounding like a broken record. And as many people know, records were replaced by CDs in the 1980s. And sometimes I feel like social care is a bit like supporting Arsenal, really. You think you're on a good run with some decent victories and in the lead. Then 3 minutes of injury time, someone comes in, steals a draw, and you're back to where you started. I just wonder what we have to do to get the attention it deserves. Next slide, please. It's difficult to know what we try next to get their attention. 30 years I've been waiting for something to happen, and by talking and do it constructively, it still hasn't brought anything up. Next slide, please. So I'm with Winston Churchill when he said, "It's the courage to continue the fight that's important." So next slide, please. Well, I'm going to continue that fight, and I urge people not to ever give up. We have to make the change for the future to benefit everyone. We owe it to the generations in front of us. We owe it to the generations we've got now, and we can't let anyone get away with it any longer, in my view. Thank you for listening.
Thank you, Mike. That was absolutely fascinating. Thank you. If anybody's got any questions for Mike, remember to put them in the Q&A box, and we'll be coming to them shortly. Next, we have Simon Bottery. Simon, before joining the King's Fund in September 2017, spent almost 10 years as Director of Policy at the older people's charity Independent Age, working on issues including care home quality, unmet needs for care, social care funding, and the social care workforce. Simon has wide experience in policy, communications and journalism, including as Director of Communications at Citizens Advice. He also worked for ActionAid in the commercial sector for Guinness and in BBC Local Radio. He's a trustee of the Charity Action Space, which supports artists with learning disabilities. Over to you, Simon. Thank you.
Thank you very much. It's a bit weird, actually, isn't it? Seeing a very large picture of yourself when you're trying to present. So I'll ask you to move on to the next slide. Thank you. That's very good news. So I wouldn't start from here. This is just a reference to that old joke about the motorist who asks for directions, stops and asks for directions. The story is usually that it's getting dark and they're in the middle of the countryside, and they stop to ask for directions, and the person says, "Well, do you know what? I wouldn't start from here if I were you." And that sort of feels a bit like the state of social care policy reform, that we're never at the right point to bring about reform. And of course, historically, the last 20-25 years, we've not managed it. Next slide, please. So yeah, this presentation, actually, I think possibly 4 Ps really here. I'll talk a little bit about the process, about fixing adult social care. I'll talk a little bit about different perspectives on social care reform, because there are very different perspectives. I'll talk a little bit about some of the problems that we need to resolve if we are going to fix adult social care. And finally, I'll talk about a little bit about the prospects for reform, whether it feels like it's likely to happen. So next slide, please. So where are we now? So this is, I did a little roadmap of where we are and where we've got to go to, and the lighter reds are the ones that are coming up. It's in immediate terms, it's probably quite important to think about, well, we've got a government with a big majority. Have a look at what it says in their manifesto about social care. And actually what you'll find is really very little. There are 3 small references to social care. One is about more money, about £1 billion extra. One is about a cross-party solution. And then the third one is basically saying the thing that we're absolutely determined to fix is catastrophic cost, people having to sell their homes to pay for care. Now, as a number of people have said already, while that is an issue, it's probably not the single biggest issue, and it's only one of a number of issues. So we've got a manifesto. We start off with a manifesto. that actually isn't very expansive about what it's trying to fix. After that, we had the famous Boris Johnson speech on the steps of 10 Downing Street with his promise to fix social care. We've got a plan, we're going to fix it. Really, we've moved backwards from then, and most recently, Helen Whately said in the House of Commons that work had begun on a plan. So we've gone from having one to work beginning on one. And in fairness, part of the reason for that is COVID-19 and that huge seismic shock to all of us, to society, to government, to the health and care systems that COVID created. And you know, Mike and other people have talked about some of the issues that COVID brought and some of the challenges that it brought, and certainly some of the changes. One of the things that happened as a result was that government realised that actually it had very little oversight of social care. It didn't know what was going on. So you'll hear again Helen Whately talk about, you know, I didn't have any levers to pull. I couldn't actually find out what was happening on the ground. And one of the consequences of that, they set up a task force which looked at a wide range of things. And I'm not going to go into those, but one of a couple of things the task force said, and it was run by David Pearson, who many know was previously Director of Adult Social Care in Nottingham. But it said a couple of things. One was that it said, actually, you've not got enough expertise in social care within the Department of Health and Social Care. And secondly, you really poor on data and oversight. And so what you'll see has happened immediately afterwards that is there has been, and there is actually in process, an upgrade of Department of Health and Social Care, its social care capacity. So a lot of new staff have come in over the last 6 months or so, and there's a job advert out for a new Director General. Social care hasn't had a Director General for several years. So there's been this real sense that actually social care is more of a priority. It is an area where we need more skill and more experience. And you'll also see that in the Integration Innovation White Paper, which came out in February. This was a bit of legislation or white paper that government was already planning. And because of the experience of social care and COVID, it bolted on a few measures. So one of them, partly was about integration and how social care works alongside ICSs. But it also brought in demands and requests and created a system where in future the plan is to have more data, more understanding of what's happening within social care, and also more oversight. And so I think Mike was talking about CQC oversight of commissioning. That's exactly the sort of measure that the Integration Innovation White Paper outlines. Now we've moved on to a stage where the department is now starting to talk informally to people about what reform will look like. And it's been talking to the voluntary sector and other bodies about the sort of things that it's thinking about and what people think ought to happen next. But two crucial things that should happen this year. One is there'll be a spending review in autumn, and that will set the financial framework, the financial window for local government for the next 3 years. So if nothing else, I would look out for that spending review in autumn and see how much money local government is going to get. There may be a discussion in there of reform of social care, or that might come later in a white paper this year. But certainly the amount of money that local government has to spend is likely to be one of the, if not the single biggest issue affecting provision of social care for the next year or two. So next slide, please. So what are we trying to fix? There's a lot of people have already spoken and said, you know, very relevant, very pertinent, very informed things about adult social care. And I've tried in the past to sort of narrow down the sorts of perspectives that we hear most commonly. And if I could have the next slide. Here we have some of those perspectives, and there's another slide in a second which has got a few more. So number one, this isn't in any order of priority or importance, but number one, this is a phrase you hear a lot: I shouldn't have to sell my house to pay for care. So the homeowner perspective, essentially. When Damian was talking about Tony Blair flagging social care as a problem going back nearly 25 years or so, that speech that he gave to Labour Party conference was exactly about this. It was about people shouldn't have to sell their homes to pay for care, and this issue of catastrophic cost is one that keeps on coming up. But it's not the only perspective, clearly. You will also see, you know, a perspective from the NHS. You know, what you'll hear is a perspective which talks about what matters is that the importance of social care as a way of defending the NHS. That, you know, if you don't fix social care, then more people will be turning up in A&E departments. Now, it's a valid perspective, but again, it's not the only perspective. Radical transformer, there are people, you know, genuine people who I've got huge respect for, who say, you know, this isn't actually about evolutionary change. What we need is a huge, massive, revolutionary change of the way that social care is delivered. And sometimes people talk about that should be much more sort of based in the community, much more a small scale, much more linked to local communities, and bringing in sort of working alongside communities and families in quite a different way. Some of those people will say, actually, we shouldn't be having care homes at all. So there are some very radical views out there that, again, you will hear. You'll also hear people say, actually, care isn't part of the state, really. It should be the responsibility of the family. It's not a view that you often hear, but it's a view that is held by a decent chunk of the population. The nationaliser, you know, if Bevan was creating the NH now, he's included social care with it, and Mike was sort of saying some of those similar things. You will hear that as a view. Number 6, the economic forecaster. This is basically what the Treasury is saying. The Treasury is basically looking at this and saying there's going to be a big increase in demand for care because of demographic factors, and actually we've got to work out how we're going to pay for it. And actually we don't like the idea that we're committing public funds to be spending a great deal more money as we go forward on adult social care. So this economic forecast of this Treasury review is an incredibly important one, which has a lot of power and is often cited as the main reason that social care reform hasn't happened yet. Next slide, please. So the personaliser, a lot of talk, Barbara and other people talked about culture. And in many ways, you look at this one, which is basically, I want care, and Gary talked about this, I want care that's centred on my needs, not determined by the service that are available. I want care that meets the issues that I have. It's probably the most fundamental one, isn't it? And in a way, it's a shame, and it's shameful that we have to put it up and say it's still only a perspective, because really we need an adult social care system that delivers these things. But nonetheless, we do have to keep on saying it. You'll find here, you know, the beleaguered provide, I want a decent rate for my services. You know, Mike said some of those things. The overwhelmed carer, many people have talked about carers. The workforce campaigner, we need to be paying care workers more. The needs threshold, this was a piece of research by Joseph Rowntree Foundation going back many years, which just said there are a lot of people who don't need sort of huge amounts of formal adult social care. They just need a little bit of extra help to stay in their home. We probably don't hear enough from those people. And then finally, local authorities, I just need more money. You know, common theme, if we had more money, we could deliver a better service for you. So the point is, huge range of perspectives, some of which are complementary, but some of which aren't, and some of which, you know, actually you can't do both things at the same time. So reform is going to have to find a way of making these things work. Next slide, please. No shortage of proposals, certainly, to fix these things. I've included here a few that talk about free personal care, several that call for sort of significant amounts of new investment. There's one about the care commitment, which is a sort of behavioural economics almost type approach to social care, that families would commit to looking after their relatives and only call on the state when they need it. And there's even one from Peter Lilly, which says basically, you know, the state should simply provide an insurance product which people should buy, and if people buy, enough people buy it, then we fix the problem. Wide range of different political perspectives represented here. Again, point is the range of perspectives that are on view and the range of proposals. Next slide, please. I'm not going to go through all these, but this is our take on the problems that need resolving, from the whole question about means testing. You know, as again, I think Damian was saying, people don't realise very often that social care is means tested. They may well have to pay for it. It's not like the NHS. Catastrophic costs, selling homes to pay for care, we've talked about. Unmet need, people have talked about. Quality of care, 15-minute care visits, people have talked about. workforce pay and conditions, again, we've discussed market fragility, care home companies and home care companies going out of business, the lack of integration between health and care, and finally, one that people haven't maybe talked about quite so much, which is the postcode lottery. You see very wide variation in access and performance from one local authority to another. Some of that is driven by demographic factors, but when you look at something like the rollout of personal budget, it's really hard to see why there would be such variation on something as basic and as simple as that. So we're going to have to find a way of tackling these broad range of problems, which is pretty daunting, and it may be one of the reasons, the scale of the problem may be one of the reasons that we struggle to move forward very quickly with it. Next slide, please. Oh yeah, and there you go. It won't all happen at once. Yeah, just a slide on the politics of it from, this is someone who's Chief of Staff to Jeremy Hunt. And what he was saying is essentially, maybe we have to start with the politics of this. Maybe the issue is we need a government, we need a prime minister that actually determines that they're going to want to make it happen. Damian talked about the reason that people don't grasp the nettle is because it stings. Well, it may be that the way to fix this problem or to move it forward at least is it'll happen when someone, a politician, decides that actually the benefit of grasping the nettle outweighs the pain of doing it. Next slide, please. So just a few lessons before we get into the discussion, some of the things that I think might be helpful. We've had a few comments about doing nothing isn't an option. I think people are saying doing nothing shouldn't be an option, but the reality is history shows us that doing nothing really is an option in adult social care reform. We've essentially done it for 25 years. But we are in an interesting position because COVID has changed the sector. It's changed the way people look at the sector, at least in the short terms, and it's put into the spotlight. So there is this element that it may be an opportunity. Maybe after all, we should start from here, although, obviously, clearly no one would want to have gone through COVID in order simply to have got us into this position. But I think a critical thing is because of the range of problems and to some extent because of the range of perspectives, we need to accept that proper reform is going to take many years to deliver. It's not going to happen in one big bang where government sort of signs off a white paper which solves all of these issues in one go, not least because of the sheer scale of the cost involved in doing that. So we'll need to think about, well, what needs to happen first, and can we get that in place, and then can we reform gradually over time? Perhaps when the white paper does come out, not being absolutely distraught and disappointed if not everything that we want is in there spelled out. Fourth point, funding. One of the critical issues is we can talk reform all we like, but actually, even with something like the Care Act, which is a very, very inspirational piece of legislation, lots of good things in it, if you don't fund it properly, then it's not going to happen. So as well as looking for a white paper that talks about reform and the measures we want, we need to see enough money alongside it. And finally, coherence, compromise. As a sector, as the people who play a part in the sector, we're going to have to be as responsible as we can. We're going to have to accept that we're not going to get everything. We're going to have to accept that there will be compromises required if we're going to do what a quarter of a century hasn't achieved, and that is bring about the type of social care reform that we all want. Thank you.
Thank you so much, Simon. We're now going to move to some questions and answers from the panelists that we've just heard from. The first question I'm going to come to is Gary, if you're okay there, Gary. I'll just give you a minute to put your microphone and your video back on while I read the question out. So, Gary, do you believe that the online activities have bridged the gap during the pandemic to help with loneliness? Or do you believe that truly there's nothing quite like face-to-face interactions and it's really important that we get back to that as soon as possible? And that was posted by an anonymous attendee.
I think it's important that you can't lead a good social life and meeting people and being with people face to face. Face-to-face contact is, I think, will always be important. But if we're going through this pandemic, technology and being online is the next best thing But there's a lot of people who haven't got this technology, don't know how to use it, or cannot afford it. So there should be a scheme where where people with learning disabilities will get free laptops, just like they do with the schools for students. So, and it's important that somebody comes and helps people how to use them. That's online, but foremost face-to-face contact, I think, is very important. People need the social life.
I agree with that, Gary, definitely. I think it's had its benefits, but face-to-face is important too, isn't it? Okay, my next question is to you, Mike. Mike, your words strike a resonance with those of us in the sector, but how do we stop the broken record and connect with politicians from all parties and encourage them to work cross-party to find a solution? Time for direct action?
Yeah, a very difficult one, that, because I think in my time, I've found it increasingly frustrating and difficult. And I noticed Damian Greene's comments earlier about getting cross-party support seems as way off as ever. I honestly don't know the answer to that, is how we're going to get them to talk together. I've seen it happen and then break down and a way forward. We've tried reasoning, haven't we? Many decades of having discussions and pointing out this politely. And I think sometimes, unfortunately, in this country, that doesn't get you anywhere. The social care voice has been too quiet. Direct action, from a legal perspective, yes, I think it can be something. We've got to shout louder. Quite what that happens, I don't know, to make the change. But I get tired of broken promises all the time. I try and vote in the right way. It doesn't happen. The social care reform, too many excuses. And I think Simon's point that he mentioned earlier, yeah, we can't expect the change all in one go, but I think at least let's do something different. Don't let's have another white paper and endless consultations. I think the time of that is over. We might not get the perfect solution. Let's make a start though, and let's get on with it today, really, action this day. But I wish I could get the politicians together, which is my point earlier, really, about if the politicians out there at the minute can't change it, perhaps we should stand ourselves in the future to make that change.
I look forward to seeing you standing in Yorkshire, Mike. Okay, thank you. Next question for Simon. Simon, does social care need more investment in research in order to shape how it is to be reformed and where money should be spent?
I mean, I'd always argue for more research. I think what we're particularly lacking is the sort of investment that looks at what works, and then crucially how you then roll it out across the country as a whole. And you've seen that sort of process go underway in the NHS, with really significant investment put behind it. The sorts of sums that we've had in social care to do that, sort of identifying the best practice, getting people to pick it up and then rolling it out, the sort of sums we've had have been absolutely tiny. So certainly I think alongside the research, what you need is a way of sharing and spreading best practice and putting money and effort and time behind that sort of innovation, yes.
Great, thank you, Simon. Moving back to Gary. Gary, you've already answered this one in the chat, but I'm asking you it out loud so that our listeners can hear. So Mervyn Eastman has asked, too many people experience the services, whatever the generation, as patronising and paternalistic. Co-production, personalisation doesn't necessarily change the power base between users, providers and commissioners. How does a panel square and address the power imbalance that exists? User ownership, control and benefit has to become the new normal post-COVID. So Gary, what were your thoughts on this one?
Well, co-production is a new word for us as people with learning disabilities. It's important that we work together with politicians, counsellors, service providers and families, all working together to provide better services. Well, you know, the services we got at the moment are a bit dated. When we think about day centres, residential homes, and then you've got all those institutions which have been renamed as ATUs. We need to get more forward thinking, and stop living in the past. And we need to have, we need to actually do more better things than we have already, because we just can't live the same way as we are doing at the moment. And we must do more for our young generation who are leaving special schools and ordinary schools, because they're our future generation. What life are they going to live if we don't change things now?
Yeah, I agree with that, Gary. Thank you. Mike, question for you from Kat Curtis. Would you agree that there is still an issue with the way social care is explained to the public, including politicians, not really understanding what it is to start with, and therefore not taking all of its complexities into account and not giving the right information to the public?
Yes, I agree with that. I think Damian himself pointed out this morning that the public don't really understand it. And it's a distressed purchase. Till you need it, you don't realise it's means tested. And they don't like it when they have to find out they've got to pay for it. So it's difficult. I don't think the public or the politicians really understand social care as much as they ought to. And I think that's up to us providers, but also the politicians, I think, to explain it better. So there is more work to do. And I think the perception could change. So it's a difficult one again, not something that changes overnight. But we have to raise the profile of what social care is much, much more than it currently is, certainly. And perhaps the pandemic, if there's something positive comes out, perhaps the pandemic will show the way. My point that I made in my presentation earlier was the spotlight is on us for a moment, but it won't be long before it disappears, in my view. Again, we've got to keep it focused on social care for long enough for change to happen.
I agree with that entirely. And I think it's always an issue in the public sector. Most other public services, such as education or even waste collection at the NHS and the police, are well known in the public's mind, whereas social care is less well known. So it's always more difficult to be a vote winner, I think, isn't it?
One of the things, Kathryn, is that happens is that we talk about it. We're good as a society about talking about the change. We're not actually good at delivering on social care. We've got to move from talking to action, and that's the bit that frustrates me and many people, I think.
Yeah, I agree. Thank you. Simon, another question from you, this one from Kevin Manier. Simon, can DHSC take social care seriously? That's Department of Health and Social Care, in case people are not clear, when the social care budget it handles is so small, especially one compared to the health budget it handles?
I'm not sure it's just the budget. The money that flows from central government down to local authorities actually comes through MHCLG rather than DHSC. But local authorities spend over 23 billion pounds on adult social care last year. So although it needs to be more, it is a very substantial amount of money. I do think there is an issue with DHSC and oversight. So, you can look at that sort of local variation that I talked of between different local authorities. And it's very hard to explain some of that variation, which is why I think the proposal to give CQC some oversight of commissioning, I think is a really good proposal. So I think it's less to do with the amount of money, although we do clearly need more money, and more to do with oversight of how that money is spent.
Thank you, Simon. I'm just going to give one last question, and this is from Lloyd Page, and I am asking Gary, please. So, Gary, sorry, my screen just moved as I was bringing up the question then. Gary, Lloyd has made the point that people with learning disabilities need money for social care living in their own homes. I'm sure you'd agree with that. What do you think might be the barriers? How do you think we might be able to open this up for people more?
Well, I know Lloyd Page very well for very many years. Yes, but the thing is, we need to get more people with learning disabilities into employment so they can buy their place or rent their place. The options will be more open for people with learning disabilities if they're able to have jobs and not rely on benefits for the rest of their lives. And this is a way forward, because at the moment the benefits are getting smaller and smaller at the moment, and by having people going into proper jobs and able to pay for where they're going to live, that is the way forward. I know there'll be some people with learning disabilities arguing against that, but that is my own view.
Thank you, Gary. And a good view that is too. I think we do need to open up the employment market more so it's accessible to everybody. I'm afraid we're out of time for questions. There are still quite a lot of questions in the Q&A box that we didn't manage to get to. So if any panelists would like to have a look and answer them, if there's one that you think you know about particularly and you could answer them on the Q&A chat box, that would be great so people can see those answers. Otherwise, I'm going to draw this to a close. Next slide, please. So if I could just let you all know about our podcast, so keep your eye out for the recording of this session, which will be in your emails, and this will be posted on our podcast YouTube channel. Next slide, please. And I just want to remind you all again, we've heard so much during this conference that I think we would all agree we've seen some very passionate advocates for the change that we need. Let's remember the people that are working that need that change in the work that they do to deliver great care, and get your nominations in there. Let's give them the recognition that they need. And don't forget the COVID hero nominations as well. And then finally, the last thing for me to do is to remind you about the face-to-face conference. If you haven't already got your tickets, get your tickets 30th of June at the Mermaid London. All of those speakers have confirmed. I'm really looking forward to this, seeing people face-to-face. As we said in one of the questions, it's great that we can do things like this online, but I'm really looking forward to getting face-to-face again. So if you haven't got your tickets, get them bought. And so lastly, thank you so much to all of our panelists. I think this has been a fantastic conference, really, really lively and engaging. Thank you so much to our sponsors who are up on the screen there now, BMB International Recruitment. And thank you most of all for our participants for attending and for asking your questions. It's been a really, really good session. Thank you all, and enjoy the rest of your day. Thank you. Bye-bye.